My name's Carly, I'm 27 years old and I'm a sister on the head and neck surgical unit. I had an anaphylactic reaction about 5 months ago whilst on a night shift, and I didn't think that anything like this could ever happen, to a nurse. So at the start of my shift there was nothing out of the ordinary, everything was as it normally was. I was getting ready and preparing for my evening IV round. A lot of patients on our unit require higher levels of care, and part of that is that they're on a lot of IV antibiotics. I got my charts ready, I went into the treatment room and I began preparing. One of the patients this time was on a drug, Anaphylaxis, which I prepared hundreds of times before. I did nothing out of the ordinary when I was preparing it. I followed procedure, I did everything that I would usually do. But as I withdrew the needle from the vial, what I think happened is the drug escaped the vial and I inhaled it, and I began to feel very unwell quite quickly. It was enough to make me stop what I was doing. I took my gown and my gloves off and I was sort of leaning and propping myself up on the side. I didn't realise what was happening. I didn't know that anything could happen like that. I'd never had an allergy before. I wouldn't have known. I'm normally fit and well. I didn't think to get help or anything at that point. A care support worker came in to ask me a question, and I turned round and she stopped asking the question and asked whether I was okay, because I'd become bright red and looked very shiny, as she put it. I looked at my arms and I noticed that I had a red patchy rash, and then that's when I started to think that maybe I was having an allergic reaction, but I didn't think it was anything serious. I thought it would pass quite quickly, so I decided to go and sit down. By the time I'd reached the nurse's station and sat down, I found it difficult to breathe, and that was very, very new. I haven't ever experienced that before, and I began to feel so exhausted that I just felt I had no energy left in my body. I couldn't even call anybody for help, and it was frightening. I didn't know what to do, and I could feel myself getting worse, and then I could hear my breathing, and I know that sound. I work on a head and neck unit. I know that I had a stridor, and I knew, and then it started to dawn on me that maybe this was anaphylaxis. The nurses next door heard my airway and thought it was one of our patients going off. Everybody just looked horrified when they saw it was me. The charge nurse, shouted, get an observation machine, we need to get help, get a doctor. And he came over and he said everything's going to be okay, but he didn't look sure. He'd already attached the obs machine to me, and I don't remember what my observations were at that time. I knew it was bad. And then the ENT doctor abruptly tried to scope me, and he said, I can't get the scope in. And he tried in my left and my right nostril, and then he went to try and look down the back of my throat and he couldn't see my cords. So then I really began to freak out and I started crying, and it was just distressing. I remember feeling like I needed to do something and I couldn't do anything. The ENT doctor said, we need to get a bed, we need to get her down to A&E now. And one of the junior nurses said, should we give some adrenaline? And nobody listened to her. Everybody was rushing around and a bed came over, and then everybody lifted me onto the bed, and then she reappeared again with a syringe of adrenaline and said, I think we should give a dose of adrenaline, which everybody agreed at this point. And I think it had already been it's hard to say, but I think probably about 8 minutes that emergency life-saving treatment hadn't been given, and it was then given at that first point. So she probably saved my life, giving me that adrenaline, and I haven't let her forget it. I want to start a conversation about anaphylaxis. The nurse that spotted what was happening to me that night saved my life, and I want to train other people to be able to do the same.